Today, we're here talking with Dr. Bally of Bodyworks Physiotherapy. She's the head chiropractor, practicing in the GTA for over 20 years. She's a firm believer that every patient's unique healthcare journey begins with chiropractic care. Dr. Bally, what are some ways chiropractic can help patients?
Well, I'm glad you asked that, Megan. Chiropractic has actually been around for hundreds, maybe even thousands of years in various cultures throughout the world. And because it's been around for so long, it's been heavily researched, extensively researched in universities. There's lots of peer reviews and journal articles about it. And chiropractic is actually only one of 5 regulated health professionals in Ontario. That is why we have a doctorate title, meaning that we are bound to our diagnosis. Just like your family doctor and your dentist give you a diagnosis, we too are legally bound to our diagnosis. So I owe it to my patients to provide them with the best care possible, just like your family doctor. And here in my practice at Bodyworks, I deal with all kinds of issues. I've seen it all, from ankle issues to shin splints to knee pain, not just low back pain, shoulder, migraines, headaches, jaw pain. If you have a joint, if you have a muscle, we can deal with that.
Dr. Bally, what are some areas of your body that you're treating more often right now?
Great question, Megan. With the pandemic, things have really pivoted, things have really shifted, and now people are forced to work from home. So now they've set up the home office, which really is the IKEA dining room table. So we're trying to navigate in that kind of environment. So I really need to know where my patients are sitting, if they're using a laptop, if they're using, their mobile phones. And so what I'm seeing a lot of is low back pain. I'm seeing a lot of headaches. I'm also seeing a lot of jaw pain from people wearing masks and having to just kind of get that mask off their face and just talking through a mask. I'm even seeing it in children because we're online learning and they're staring at a screen and everyone's hunched over like an orangutan. So that's kind of what I've seen a lot in my practice recently.
Okay. What kind of techniques do chiropractors use to help with these new pain complaints?
Great question. There are so many techniques that we have in our toolbox. But some of the basic techniques is one of the first things is soft tissue work. So I need to get into your muscles and stretch you out and relax them. So I need to know where the source of a lot of this pain is coming from. Is it from sitting a lot? Is it from repetitive strains, standing? So I need to get in there and figure out what's going on with that. That might lead me to manual therapy. Manual therapy is when a joint is stuck, it's not moving well. And what I do is I get in there and I gently mobilize that joint to give it some joint play. I need to see movement in that joint. If there's not movement, then the muscles around that joint are going to not solidify, but they're going to get stuck. They're going to spasm and it won't allow your joint to move in the angles and axes that it's supposed to. So what I do is what's called an adjustment. And an adjustment is a very safe and effective way to mobilize the joint to free up restriction. The third technique, is my favorite part of it, is not only will we treat you here at Bodyworks, but I'm going to send you home with tools. I'm going to send you home with exercises and various self-management techniques. I might say, what's going on at your desk? Do you have a proper chair? Do you have lumbar support? Do you have something under your feet? If you're an athlete, we might say, okay, what kind of stretches are you doing? And give you some more stretches to do to make it part of your daily routine. Nothing too overwhelming because I know life gets away from us. Just something that's manageable and tangible that we can help you with at home.
What are some other problems that you treat that people might not normally seek chiropractic out for?
Yeah, chiropractic is not just low backs. Chiropractic is postpartum. So I have a lot of patients who are pre or postpartum. You want to make sure that mom is able to deal with the low back pain, the increased weight that they're going to take on while the baby's developing in the body. I want to give them support techniques, make sure the joints are moving, make sure everything's doing what it's supposed to do so that the 9 months don't seem like excruciating all in that time. Athletes. I've got athletes, high performance athletes that I need to keep them on their marks. Their bodies need to be maintained throughout their whole professional or semi-professional career. I've got factory workers, construction workers that are like, Dr. B, you got to get me out there. It's a matter of my job. It's my income. And so I need to kind of work around their schedules and figure out what I'm going to do with them, and keep them coming back in and be able to work in their jobs. Even the fact, like, especially during the pandemic, we had a lot of patients that we were their only touch base points, because everything was shut down. They had no one else to talk to, and they're just dealing with a lot of emotional stress. So we were their sounding boards, because stress has a huge effect on the body. So I was there to help them through that. And sometimes it was just talking it out and realizing, well, they just needed someone to talk to. So it's all encompassing. It's not just cracking low backs. It's everything.
What are the benefits of doing a maintenance plan for chiropractic care?
Yeah, I'm a huge advocate of maintenance care. We get you to a certain point here at Bodyworks, but we want to maintain that, great results that we got with you. So I very truly believe in coming and seeing your chiropractor maybe once a month, once every 6 weeks. So you tune your car up, you tune your body up. You see your dentist every 6 weeks, and like clockwork, you book, not 6 weeks, 6 months, like clockwork, you book. You don't hesitate, you don't question. So that's what I want to do. Like, your body is the most important thing that you have. So keeping up your maintenance is really important.
Absolutely. So Dr. Bally, these conditions, these are all things that you and your team can treat at Bodyworks?
Oh, absolutely. No problem. We've seen it all. We have years and years and years of experience. So we possess the skills, the qualifications, the treatment options that can help keep your body in check.
So with the information you've given us today, what's the next step for anyone looking for excellent family chiropractic care?
Great question. I want you to come in and book an appointment with us, but you can check us out at www.bodyworksphysio.ca or call us at 1-866-7physio. That's the number 7, PHYSIO, and set up your assessment or consultation with our amazing Bodyworks team.
Awesome. Thanks, Dr. Bally. I really appreciate you talking with us today.
Thanks.